Good afternoon. Welcome to the EMA office for day 319, where we bring you the latest in the COVID numbers. I'm joined here with Chairman Mark Kern and Sam Bierman from the Health Department. And Sam, you have the numbers today.
Yes, we do. So as of today, 248,112 St. Clair County residents have been tested, which is an increase of 1,014 from yesterday. We have 25,499 positive test results. That is an increase of 71 from yesterday. And that does include both males and females from under the age of 10 up to their 90s. Today, our daily county positivity rate is 7%, and we are at 222,613 negative test results. Unfortunately, we are announcing 5 additional deaths to St. Clair County, which does bring the total to 398. We had a female in her 70s, a female in her 80s, a male in his 80s, a female in her 90s, and a male in his 100s, all with unknown health conditions. And as always, our sympathies go out to their families. For those who have completed the IDPH required 10-day isolation period, we are at 23,777. For state totals, 15,553,319 have been tested, with 1,108,430 positive test results, which is an increase of 3,667 from yesterday. And for deaths, the state is reporting 18,883, which is an increase of 87 from yesterday. For St. Clair County hospitals, currently we have 94 patients that are admitted due to COVID-related reasons, and 3 of them are on ventilators. Regionally, we have 166 patients that are admitted due to COVID-related reasons, and 9 of them are on ventilators. For our congregate living facilities that are currently or previously been in outbreak status, please remember these numbers are cumulative and that we will only announce any facilities that have had changes. Cedar Ridge of Lebanon has 170 cases and 21 deaths, and that is an increase of 1 case and 1 death for that facility. Freeburg Care Center has 137 cases and 13 deaths, and that is an increase of 2 deaths for that facility. Integrity Healthcare of Belleville has 96 cases and 6 deaths, and that is an increase of 1 death for that facility. And finally, Mercy Rehab and Care Center in Swansea has 126 cases and 18 deaths, and that is an increase of 1 death for that facility. And I will turn it over to Chairman Kern for his update.
Thanks, Sam. We'll go into the zip code report. Today, these are the changes in the zip code positivities or positives in each zip code. In 62203, we start off down 1 today to 561. 62204 is up 1 to 360. 62205 up 2 to 588. 62206 up 3 to 1155. 62207 up 1 to 534. 62208 up 6 to 1434. 62220 up 14 to 1779. 62221 up 7 to 2,437. 62223 up 7 to 1,522. 62226 up 16 to 2,808. 62232 is up 4 to 811. 62239 is up 5 to 414. 62240 is also up 5 to 143. 62243 is up 2 to 658. 62254 up 6 to 725. 62257 up 1 to 293. 62258 up 2 to 922. 62260 up 4 to 685. 62269 up 13 to 2,881. 62282 up 1 to 56. And 62285 up 3 to 482. 71 new positives today with 1,014 people tested, brings our daily county positivity to a great number. We're at 7% today. That's much better than what we've been. That brings our rolling average down today to 8.8%. So it's another pretty good day with that rolling average. We want to drill it down farther, but at least it's going down. Regional positivity, which is how the state looks at us, and this is important because we need this number to be below 8 for 3 days to get to indoor dining again at 25% capacity. So today we're at 7.7%. That's the second day below 8. Unfortunately, the hospitalization numbers have ticked the other way, so we're going to have to start with 3 days now of hospitalizations and regional positivity below 8 to be able to get back open. But fingers are crossed. Today, hospitalizations are down in St. Clair County, so there is a bit of a lag with the state's numbers. So we're hoping that we'll be able to see some reopening and a mitigation lifted soon. Bond County called in today at 7.8% positivity. Clinton, 12.1%. Madison, 9.1%. Monroe's at 15.5%. Randolph, 2.5%. St. Clair's at 10.5%. And Washington County is at 14% today. So, Herb, it's the hospitalizations, the amount of the availability of beds is really the sticking point. The other sticking point is, the state came and we're talking about a mass vaccination site, but we're not really hearing from the state as to the amount of vaccine that's going to be available, the amount of personnel that are going to be here, and when they're going to be here. So our goal still is to get up and running on Monday. We hope our partners with the state of Illinois are going to give us some answers now so that we can inform the public and let them know when to make appointments to get vaccinated.
Well, and when we tell our viewers, we're working on this every day, and it's been another one of those days from early this morning at the mass site at the fairgrounds, getting the final touches put on that. We're ready. Mila and Sam and the staff here at the EOC, we're working on a call center to help those people. But again, we can't release that portal for people to start signing up until we know the amount of vaccine we're going to have.
And the number of people that are going to be stationed there.
Exactly.
So while we are in control of our destiny, and we've done everything we promised to do, we're waiting on our partners with the state now to give us confirmation that they're going to have the vaccine there and some of the personnel to be able to handle this mass vaccination site.
Well, and for those of you who have one on and signed up either on the EMA page here on the Facebook or on the Health Department's page or the county website, we're at 47,886 of you have done that to date. We want to get that message out to you, but again, until we know that vaccine comes in, it's useless for us to notify. So please just hang in there. I see some questions on here now. Continue to tell your friends and neighbors to go on, get signed up. Doesn't mean you're signing up. It just says you're interested in getting the vaccine. Once we know how much we're getting, then we will send out those notifications. As I said, we've got a call center that's going to be set up. We'll have the staff making those notifications by your email, by the phone, letting you know to go on at that time and schedule your appointment. You'll be able to do that on your own, but we can't schedule 47,000 people and we don't have but 100 doses of vaccine. So,
and normally, we're going to start off doing 1,200 a day, and we have to know we have 1,200 doses available so that the last person that arrives at the fairgrounds at whatever time at 8 o'clock at night or 7 o'clock at night, that there's still vaccine left for that person. So that if you make the appointment, we want to make sure that you get the vaccine that day. That's only fair to you, and it's the right thing to do to be able to make this process work smoothly. But until we get confirmation from the state of Illinois that vaccine definitely will be here, we're not going to be able to make those appointments. So,
well, as we talked earlier, there's been a lot of work just late last week and this week early already with the National Guard. Today, I got a call where they've assigned a liaison chief from the National Guard that will be here stationed at the EOC. So all those wheels are turning, but the two components now is the vaccine and then the other staffing that we need. We got our fingers crossed that we'll get that call still yet today, maybe tomorrow on that. I know Mila is every time the phone rings, she's jumping right on it because she's waiting for that call, her and Sam and everybody. So
And it's really the Illinois Department of Public Health's call.
Yes.
And so that's who we're waiting for to make this decision final.
So we appreciate everybody joining us today for 319. That's right, 319. We've been here. We're going to be here. We're just getting into the weeds now on the vaccine. As we said, the site is ready to go. We've got our part all ready to go. Once we get that vaccine, we'll be calling people and getting those shots in your arm. So we'll be back with Daisy and Cindy in a few moments to translate this into our Spanish communities, and then we'll be back tomorrow, hopefully with that important news that we can get out to everybody for day 320. Everybody have a good evening.
One of the ways we can combat widespread infection is testing. It's been proven time and time again that many people who were infected with COVID-19 are asymptomatic, showing no signs of infection. They unknowingly spread the virus to those most vulnerable in our community. Working together with health departments in our region, free testing has been made available throughout the area, and we encourage all citizens and visitors to take advantage of this opportunity. To Team St. Clair and the rest of Region 4, if we work together, we can and will stop the spread of COVID-19.